how you doing, guys? So we have a special guest all the way from London, okay, right across the pond. Okay, so we already did a very extensive consultation. What is it now? Yeah, that was 2 hours to break everything down over here. Okay, so the main topic we're talking about this is severe constipation, right? And we're talking about what's causing it in this particular patient's case, and how we're going to address it. So let's get to the bullet points for the viewers over here. I understand you've been having this for the past 10 years.
That's correct.
Okay, and also lately in the past 4 or 5 years ago, you started to have rectal prolapse.
I had it, yes, 4 years ago, yes.
Okay, but it wasn't sticking out too much.
Not too much, no, but it was visible.
Gotcha. And you had surgery for that?
I had, during 2 years ago, during pandemic, yes.
Okay, so they did sutures as well as they stitch it up, but no mesh?
No, they didn't add that.
Okay, so that's important. Okay, that tells you how, it's significant enough, viewers, but not severe for the rectal prolapse. So that's one data right there. And also, in terms of bowel movements, prior to that, how often do you go?
To the toilet?
Yeah.
If I could, I would probably go every day, but that wasn't happening because I wasn't physically able to do it. But I felt the signal of going, but I couldn't pass the stool. That was a problem.
Okay.
So it was every 3-4 days with some help here and there, but never, it wasn't happening by itself, like a normal person.
Understood. So if you had no help and no medications, okay, and coffee and tea, all that stuff, how often would you go then?
I maybe once a week if it was possible. I don't really know at the point because it wasn't possible basically.
Gotcha. So one time a week, that bad. Okay, all right. So you mentioned that sometimes you also have burping issues. Let's clarify that.
I do. So it mainly happens when I brush my teeth, which is very weird and I realize it's from the toothpaste. So the one everyone uses because of the peppermint or mint there, I can't because it makes me burping and it makes me basically feel awkward and weird. So I switched the toothpaste to a different one and kind of better. But also it's like perfume or scents or the things you use when you clean your house with. I can't have any of them near me.
Gotcha. Since you mentioned about, we got problems with burping, all that stuff. There's actually 2 sphincters on the stomach, right? If there is no traffic jam, it's supposed to program these sphincters, close them, keep it closed, right? And it won't so the gas won't go through.
Right.
But because this is that nerve over there's a problem, the sphincters itself, is also not too reliable as well. Now, usually it's a parasympathetic problem, but I'm going to show to the viewers on the x-rays in a bit, how everything's all still connected from here down to here, how the parasympathetic is not forcing these sphincters to stay closed. But also part of the problem is the fact that in the x-ray we see your sigmoid colon, there's all the gas in there, and going up to the descending colon, and backtracking, and it's going right through the sphincter, bottom right over here, build up gas a little bit, and immediately goes right through here as well. So now let's break it all down. Now when I'm hearing about constipation, right, and especially with all the things we've got going on, which is the rectal prolapse over here. No issue, no rectal incontinence, but no issues with the orgasms and so on and so forth. And on top of that, the pelvic muscle floor seems to be intact with your medical doctor. You did all your tests. They found it was fine. So the sacral nerves is where I really want to focus on. More precisely, 2, 3, and 4. So since you have no rectal incontinence, and that means if there's an issue right over here, usually the 4S nerve controls the rectum right over here. So in other words, you go to the toilet, and those who are the rectal incontinence, they say, oh, wait a second, I just wiped, but then like 30 seconds later on, or even like they just left the toilet, it says, oops, oh my goodness, I had to go wipe again. That's rectal incontinence. You don't have that problem. So, and on top of that, the orgasm, it didn't change prior to 10 years and prior to to the surgery. So there, also again, that tells me the fourth sacral nerve seems to be okay. Now we have to go up to the next level. So the higher ups, either third or second sacral nerve issues, okay? If there's some traffic jams there, there's a nerve weakness there, that could still explain this prolapse over here. Now, the fact that, you show me the pictures, and I don't want to be too graphic to the viewers, but we're talking about if we say this is rectum, the prolapse, it's just a little peek out, not like a huge amount. So again, that tells me more of the, okay, we're dealing with the upper sacral nerve issue.
Yeah.
Okay, so now I really want to take a closer look during examination what we got on the upper part over here. Okay, now another thing I want to point out, I'll point out in a bit there. Okay, I do see a potential old right ilium problem. Okay, so the way it misaligns, it has the potential to irritate that fourth sacral nerve. So you still may have an issue, but yes and no.
Right.
So in other words, once we start stabilizing this, then it may start irritating and causing that problem itself. It's a possibility. Okay. Now the sigmoid colon itself, again, it requires the sacral nerves 2, 3, and 4 to function. But once more again, the fourth sacral nerve seems to be okay. Okay. And the motility and all the other, the MRIs they've done, they tested on that, including the biopsies. So again, it leads me to, okay, we're gonna take a look at the upper areas. That's second sacral nerve issues. Okay. Now, in terms of what else we got there. Now, other things you also mentioned about other component in your consultation is migraine headaches. Okay. So we'll touch base on that too, and how it all connects to the cervical region. Okay. As the viewers can see over here, we do have a significant amount of gas bloating right on this descending colon over here. Sigmoid colon is completely compacted with a lot of fecal material over here. There is an open gap, posterior wedge right there on that second sacral segment over here. And in addition to, okay, because the way this hip is, it's tilting a little bit down this way over here. Now, traditionally what makes that thing to go downwards this way is usually going to be a PI, EX, PIX, or an anatomical short leg on that side. Okay, biomechanically speaking, that is. In addition to, I want to see this thing go forward. However, if there's an acute sacral segment, it can negate that and make the sacrum tilt backwards more than it should. I want this fella in neutral position here. Okay, so we got that dynamic. All right, and we also have this fifth lumbar vertebra over here. Okay, this fellow is moving backwards.
Right. Now,
this fellow has been a problem for so long. You can see that little oval shape here. Okay, that oval shape is that liquid bulk bearing the nucleus pulposus. It's been there for so many years. It actually dented the end plates on the bottom and top part, and it also causes this stair-stepping effect, this down effect, also known as Schuberman's. Okay, all over here. So when we keep tracing it down, and since it goes past that, okay, that's how we, for the young docs and the students over here, if I see this stair-stepping effect, okay, I'm looking for where does the last stop. Problem is, it doesn't stop here. It keeps on going even to the sacrum past that. So therefore, that's how I'm able to identify the original problem is past the lumbars. It's actually a pelvis problem. Now we just got to isolate which one's which.
Yes.
Okay, so that's why we got that component. Now, when we move up a little higher up here, one thing I like to see, which is a good thing, you don't have a mating blast, okay? Which is, there's so much gas in the stomach, it's almost like a balloon, okay?
Right.
So we don't exactly have that, so that's a good news over there. But you see this little cloudy thing over here?
Yeah.
Okay, a little over here?
Yeah.
Okay, so there is some gas going in there, but at least your stomach's trying to fight it and keep all this gas down below, so that's a good thing. All this clear space, that tells me your small intestines is working just fine. That's not an issue there.
Okay.
Okay, so again,
That's a good news.
over here, all good news. This is all, and I don't see any issue with the transverse or the ascending colon. Good news, but everything's in the descending colon.
Yes.
Okay, so we got that component. I do see an issue right there mid-dorsal, so that's going to help calm down the stomach nerve over there. Okay, when we go up to here, okay, I am seeing an issue with this sixth cervical and also the fourth cervical. Right, I want to confirm on that here because by addressing that sixth cervical, it's going to help recenter your spine a little bit, and takes some of the pressure off for your migraine headaches. However, because this fourth cervical is also inferior, and the way this nucleus pulposus is, by adjusting that 6, okay, this 4 is eventually going to start showing up again. All right, so it may not be too strong right now, but I wouldn't be surprised it's going to start even stronger in the future. So therefore, either myself or the Gonstead doc in London got to keep an eye on that thing and adjust accordingly when it shows up. Now that being said, okay, being all these kinds of biomechanical stresses and strains I'm seeing over here, well, I'm going to confirm that on examination on you. Most likely, the way I see is this: we may need to triage it, address that second sacral segment first, okay, either the 5th or 4th lumbar, and this has to be a future visit. As much as I have to adjust that in the future, can't. I'm pretty certain, okay, that right old hip injury that needs to be addressed in the future over there. Another component is, just as I mentioned to the viewers before, okay, I do see a little irritation on fourth sacral nerve over here, but this compensation from that hip. The reason why it's doing that, we see the right hip over here. Okay? There are ligaments that attach from here to the sacrum itself over here. So every time this hip over here starts rotating, starts to tilt backwards like this way, it's pulling this ligament a little more like downwards this way. And also when this fell over here, it goes EX, externally rotated, it's also yanking this way. So because it's yanking so much, this fourth sacral segment over here, it can rotate and start irritating a little bit. So that's something we got to keep in mind on. So therefore, as these two start stabilizing, that's what we're talking about before, you may, I'm not guaranteeing it, but you may start experiencing some fourth sacral nerve issues, right? So, okay, let's go ahead, let's take a look, see what we got. So there is some edema here, but not a whole lot. But the viewers can see over here, there is a lot of puffiness, a lot of swelling all around here. So the body's trying to stabilize, protect something. Same thing here. There's a lot of muscle spasm, more so on the left-hand side than the right, and including the neck. See, this is the upper part over here, muscle spasms are tight. There's also muscle spasms and swollen right over here as well. Now I'm going to start confirming that data over there. We're using this instrument device over here. This helps us identify some problematic areas we need to take a closer look at. So even that for us is in trouble a bit. Got a smaller reading there. That's what I figured right there. There's one right there. Yeah, no, right there. Exactly. How's this fellow right here?
A bit pain, just a bit.
Just a bit, right? This is the fourth sacral segment right there. How's this fellow right there?
Yeah, that's painful.
Painful. This is a 2S.
Yes.
How's that fellow?
2.
How's this one?
2 as well.
Yeah, this is the 5th lumbar. How's the left hip? Not too bad?
Not too bad, but I can feel it, but not too bad.
How's this right hip here?
No,
No, that's not moving too well.
Yeah, no, that's painful.
Painful right there.
Yes.
Okay, so we've got a PI ilium going on over here. 5th lumbar as well.
Yes.
How's that fellow right there?
It's a bit painful.
See,
Sharp.
Yeah, this is not moving at all. Not too bad there, huh? How's that fellow right there? See, that's not moving.
Yeah.
That 6 is not moving. That's not moving to a lot of the fourth cervical. Okay. All right. Okay, so there's another thing I also want to mention about this case. So in regards to where her migraine headaches are coming from. So you can see right here, this occiput slightly anterior and superior. So that's in reaction to what's going on down here. So because this sixth cervical over here is inferior, so is this fourth cervical is inferior. So this keeps on going backwards over here. It's causing that occiput to go a little bit this way. So this is actually a false positive, and that's where her migraine is coming from. So once we start addressing these two over here, the occiput should start re-leveling over here, and I wouldn't be surprised her migraine and aura start disappearing from that. Okay, go ahead, march in place.
Both?
Yes. Okay, alright, so it's slightly stuck. Okay. Okay, that's moving just fine. Okay, just the right, please. That's stuck. Move it. Just the left, please. Okay, all right, stop right there. So basically what I'm looking for is this, okay? As she is marching in place over here, I'm looking for a PSI, it should move. Her right side over here is partially fixated, but it's not fully fixated itself. However, when I'm checking the sacral segments, okay, fourth sacral segment is slightly fixated, but not really, but her 2S, that's very fixated. So that's one of the things we need to address first. And I don't know if you guys heard it, while we were assessing over here, you hear that little clunk. Go ahead, march in place. Okay, actually alternate please, left and right. Okay, so sometimes it was doing that. So sometimes when this thing was starting to clunk over here, it tells me it's like the fifth lumbar is very unstable. And that's due to a combination of both she has here. So she has that 2S problem, and also that right ilium problem over here. That's what's causing this. For her muscles and the tendons start rubbing against that fifth lumbar over here. And that's what's making that nice little, a little funk sound over here. Drop the belt. Let it go. I know. You're gonna set this poor fella back in place. Just breathe. I know. Just breathe. So tell me, what's different in there?
It feels light.
Light.
But it feels heavy on the up there, you know?
Okay.
But where you've done it's light and then heavy up there.
Okay, that's understandable.
Yeah.
Do you notice any other changes or differences in your bowels or any gas bloating changes?
Not sure. I think it feels lighter. Is it that correct? I mean, like it feels lighter, just in general.
Lighter in what way? Like it says.
It's not that tight.
Not that tight.
Mm-hmm.
Okay, so as long as your belly right now doesn't feel that
tight, no.
Not that tight. So
yeah.
Would you say that it's like less bloating or just simply just muscle?
I would say less.
Less. Okay.
Yeah. Mm-hmm.
That's a good promise. Okay. I'm gonna set this fella. Relax his shoulder. Okay. All right. So tell me, what's different in there?
No pain. No, it was a sharp pain when I was moving. It's gone.
All right. That's good. All right. So right, I understand you had that left sciatica, but that's that's nice to have that result. But any difference you notice in the gas bloating?
Yeah, I can actually I can move my stomach easier.
That's good.
Yeah, I can. I really can.
All right, hey, that's great.
Yeah.
Okay, let's work on everything else. Let it go. Let's set this inferiority a little bit. What do you notice that's different right now?
It's lighter on the chest right now.
Good. How's your stomach? How's that feeling?
Yeah, I can move it very easily. I wasn't able to do it before.
Okay, but we're talking the stomach itself, not the belly, but the stomach. The chest region right over here. You notice any difference there?
I can move it. It's not stiff.
Okay.
Yeah.
Good.
Yeah.
Right. Let's take a look at everything else. Okay. Come on.
I can move the neck finally. Oh, this side. This one feels different to this one, or it's just me?
Well, you told me.
I think this one feels like I can move it very easily. This one feels a bit more stiff.
Okay. I'm not surprised about that.
Okay.
Because there's no way I could adjust your fourth cervical yet.
Yes.
We need to take one step at a time. 6 cervicals first. Once that stabilizes and heals up,
Yeah.
okay, I want to reiterate once again, don't be surprised. You may experience a little more migraine headaches.
Right.
Okay? I'm expecting that. Okay, because your body is trying to readapt.
Right.
Okay. So we'll take a look at that in future visits when it's ready. Same story with the right hips. So okay. So not bad. So now overall, how's your belly right now?
It feels better.
Okay.
Lighter and like not stiff and less bloated.
Good, good. So tell you what, okay, on the next following video, okay, let us know how's your constipation, how's your bowel movements.
Okay.
All right.
So what should I notice, like a difference, or should I look for both?
Well, you told me.
Okay.
Everyone's gonna be different, so I just need to know how your bowel movements are in general, and also your gas and bloating. All right. Now, here's your homework. Right? I want you to ice your low back over here because the nerve there is very swollen. As that nerve pressure start calming down, okay, I'm expecting some changes over there, but you gotta let me know the next following visit how that's coming along, okay? So therefore, let me know how that bowel movement is coming along with that, okay? And let's see, and also because that nerve is gonna start functioning a little bit better, right? I'm glad that your hotel is not too far from here, I hope, right?
It's 5 minutes from here.
5 minutes, perfect, okay? Don't be surprised in the next few hours, you may have some bowel movements.
Interesting, okay.
Okay? Yeah, so I strongly recommend, don't go beyond 15 minutes away from a toilet.
Okay, sounds good. I'll go to the
Okay, we're saying like, because some of our, severe constipated patients, okay? Sometimes they'll get a bowel movement within the next 2 hours after an adjustment like this. Okay? Okay?
Sounds good. Thank you so much.
Oh, you're welcome. All right. Give us the latest updates. It's from yesterday. How's everything coming along?
So basically, when it comes to the neck, it was much better. I didn't feel the pain that much, and I slept much better than previously. When it comes to the constipation, my belly, the belly felt all right for the entire afternoon, and this morning I woke up a bit bloated and I could feel like it's inflamed a bit, but I'm not sure that was the reason, but it was in general much better. But I didn't go to the bathroom yesterday or today. Okay. But it didn't feel like I need, there wasn't a need, like an urgency or something. I didn't feel that.
All right, that's good.
Yes. So that's that, and something else I should add. Basically, the hand, the palm pain, it got better, but it's when I start work on my computer, it gets back to being a bit painful.
All right, so to recap the constipation, so the important thing is the gas and bloating, it stayed calm throughout all of yesterday and mostly this morning. A little minor flare up this morning. Yes. And more importantly, even though you usually feel like the need to go, this time you actually did not feel the need to go at all.
No, I didn't feel the need to go.
But yet, no bowel movements yet.
No, there was no.
So, no. More important is the signal, that the fact that you don't feel like you have the need to go. Okay, sounds like things are starting to operate again. And the gas and bloating still calmed down.
Yes.
That's very good progress.
Okay.
Okay, all right, thank you for that.
Thank you so much.
Excellent. Tell me, what's different in there?
I'm not sure. I think the pain is still the same here.
Okay.
It's like a sharp in one place.
All right, fair enough.
Not sure if that's that thing, but yeah, that's why.
Because we're doing something new and different, because that second sacral segment is actually holding. That's where we migrated off to your old right hip injury. So we set that fellow over there. Do you notice any other difference right now to your gas, bloating, the belly?
Right now, so again, I feel it's more like more movement in my belly.
Oh, you feel more movement in there?
Yes, right now.
Okay. Anything else?
And it's lighter on the hip. I feel, lighter on the hip.
All right. Let's just over here. Good. There we go. Good. Coming up. How's everything else so far?
I feel less pain here in the neck.
Good.
Much lighter on the hips. Still, the pain over here is a little bit sharp. I'm not sure if it's...
Where?
Here.
Yeah.
But it feels much lighter here on
Good.
the neck.
Good.
Yeah.
All right. We'll keep at it. Okay?
Thank you.
All right. Well, thank you for the updates.
Thank you. So it's been quite well. There's no pain in my chest area as it was before. The neck is so much better. And I also had bowel movements this morning. So it happened. Yeah.
All right.
The thing is that it wasn't the easiest, but finally I felt like I have the power to even push, and before I didn't really feel that. So it was a huge, it was a surprise, but obviously I was pleasantly surprised by that. So it was really, really good.
Hey, that's great. How does it get some bloating in your belly now?
I don't think, this morning I woke up without none of them. So I think it's
that's
a huge
great.
improvement.
No,
So
that is a huge improvement. So
Yeah.
that tells us that your whole anterior nerves, okay, and the nerves into your bowel, all that is starting to work again, okay?
Yes.
So we're gonna do some more adjustments, okay,
Yes.
as needed to continue to restore the nerve function into your bowels.
Yeah.
And I do recommend continue seeing the Gonstead doctor in London so they could pick up from there and do some more work to restore even more nerve function.
I'll do that for sure. Thank you so much.
Oh, you're very welcome. Okay, thank you for the updates.